This case study was on Kai, who suffered a stroke. In his initial eval, he was a total assist in feeding, grooming, lower body dressing, and upper and lower body bathing. In all these tasks, although he had right upper extremity ability to assist, he requested another individual perform the tasks for him. He was a max assist in upper body dressing, as he provided minimal assistance when someone else was dressing him in a button-up shirt in the video. Toileting was considered set up, as he wasn't transferred to a toilet but had a bag and pad on the bed to manage. Regarding his transfers, he was a max assist in bed mobility, since he was able to roll over some but required further assistance for full bed mobility. He was a total assist for bed to transfer and would have been for toilet transfer as well. He was also a total assist for ambulation, as individuals had to carry him down the stairs and also had to pick him up when he was being moved from his wheelchair to a taxi. He would need to be assessed for tub and shower transfers, as we didn't see that. And for beyond basic ADL, sensory integration wasn't addressed and play skills was not age appropriate. Education participation concerns weren't an issue, as he was educated since he was an English teacher in Vietnam. However, a concern was his lack of emotional regulation. Regarding Kai's upper extremity functions, his left side was more impaired than the right. On the left side, for shoulder, elbow, forearm, wrist, and digits, active range of motion was impaired due to tone, and passive range of motion would need to be assessed to determine end range. His manual muscle testing was impaired, as his left upper extremity was paralyzed, making it 0 out of 5. On the right side, for shoulder, elbow, forearm, wrist, and digits, active range of motion seemed to be within functional limits, while passive range of motion would need to be assessed again to determine end range. Manual muscle testing was impaired and considered to be 3 out of 5. No visible swelling was seen on the right or left sides. However, sensation would need to be addressed for both. Grip and pinch strength on the left were impaired due to tone, and the right was most likely impaired but would need to be further assessed. Muscle tone was impaired on the left, being hypertonic, and postural alignment was impaired. Regarding coordination, the right side was within functional limits for gross and fine motor. However, the left was absent. Motor planning was impaired and reduced, and pain was reported around his left upper extremity. One thing to make note of is that the client had the ability to volitionally move his right upper extremity, but did not participate in ADLs, so further assessments would need to be done to determine full range of deficits. Moving on to functional components for Kai, specifically his lower extremity, he was able to volitionally move his right leg, and we would refer him to physical therapy to address his left. His sitting static balance needed assistance with a wheelchair with arm supports, and his dynamic balance was a max assist. For his standing balance, he was a total assist for both static and dynamic, and for both sitting and standing balance, he was impaired for ADLs when looking at functional endurance. He required glasses, however, hearing and communication were within functional limits. Evaluation of his cognition showed that he was cooperative yet also agitated at times. His orientation was intact, as he was oriented to person, place, time, and situation. Moving on to special mental functions, he showed impaired emotional regulation. However, attention, memory, sequencing, problem solving, initiation, and executive functioning would need to be further assessed, as he wasn't challenged in these areas during the video. For global mental functions, he was consciously aware the entire time and was ANO times 4, which shows his orientation is intact. And for communication, he was completely verbal with communicating and responses.
Hello, it's Daryl. For the occupational therapy discharge summary, we said that the date of service would start 8/6/20, and there would be approximately 20 sessions. So for feeding, grooming, upper body dressing, toileting, supine to sit, sit to supine, and stand to sit, we would say that we wanted him to be at an independent assistance level. And then for lower body dressing and bathing, we said that we would accept a modified independence level. So the modifications would be, for the dressing, we'd say use a dressing stick to assist with dressing. For bathing, we'd say use a tub bench and/or a long handled sponge. And for the transfer, we said that we would like for him to be able to do that with supervision. We did not So it wasn't applicable to see the sensory integration, play skills. It wasn't age appropriate for him, and we did not know the education participation concerns, so they weren't applicable either. So for his left shoulder, his AROM improved, his PROM improved, his MMT was 3 out of 5. Sensation was not applicable, and then the tone improved as well, and there was no edema. For his left shoulder, there was improvement in AROM, PROM. There was a 3 out of 5 for MMT. Sensation was not applicable, and tone was improved, and there was no edema. For his left forearm, his AROM and PROM improved, as well as his tone, and he had a 3 out of 5 MMT, and sensation and edema were not applicable. His left wrist improved AROM, PROM, and tone, and sensation and edema was not applicable, and his MMT would be a 3 out of 5 as well. Left digits have improved AROM and PROM and tone, and MMT was 3 out of 5, and sensation was not applicable, nor was edema. So it's kind of pretty much the same on the right side, except his right side was the affected side. So for right shoulder, elbow, forearm, wrist, and digits, we said that we wanted them to become within functional limits before discharge. His PROM was not applicable. Of the right shoulder, elbow, forearm, wrist, or the digits. So sensation and edema were not applicable in any of those areas, nor was tone. We said that the gross right function was within functional limits, as well as the left. We also said that fine motor skills in the right were within functional limits, but his left side was impaired. Still, it's okay if he has a little less function in his left hand, as that is the affected one. His general lower extremity appearance, so he's able to move volitionally with and without assistance. We would also refer them to PT. So sitting static balance, sitting dynamic balance, and sitting functional endurance were all within functional limits. Standing static balance, we said that it was safe with assisted device such as a walker. Standing dynamic balance is safe with assisted device, as I said before, a walker. Standing functional endurance would be impaired for ADLs, and he can tolerate 10 minutes of it at a time. For assisted devices, we could also use a cane. Let's see. Visual perception, glasses are required for him. Communication is within functional limits. He is cooperative as far as his cognition goes. He needs to be oriented to the person, place, time, and situation. So we want him to have at least 4 out of 5 goals. And if not goals met, reasons for not meeting would be like an unplanned discharge. And adaptive equipment would be a tub bench or dressing stick or a long-handled sponge. And there would not be any continued therapy or referring a client to additional services. We would recommend supervision for home setting, like intermittent supervision. That's all. Thanks.